Hello. So today we are going to be talking about polio. Poliomyelitis, or commonly known as polio, is a disease caused by the polio virus. There are three serotypes of the polio virus. There is poliovirus 1, or PV1, poliovirus 2, or PV2, and poliovirus 3, or PV3. So just because you have immunity to one of these does not mean you will be immune to all of them. So following the serotypes, there is also a wild type virus, and this is distinguished from the vaccine-derived poliovirus. So the vaccine-derived poliovirus is an attenuated vaccine virus that has reverted to virulence and is now in circulation, whereas the wild type virus has been eradicated. When it comes to the poliovirus, there's kind of like three different spectrums. So there's some people who show zero symptoms. You wouldn't even know that they have it. They may be a carrier. However, there are some that show flu-like symptoms, which include headache, fever, fatigue, vomiting, sore throat, stiff neck, pain in the limbs. And then we're going to be talking about a 1% of the population who contract it, and this can cause paralysis if the motor nerves are infected. Seemingly, this seems to target more of adolescents and young adults, but mainly it affects children 5 years of age and under. So just a little fun fact, this is my grandma and my grandpa. This is Jim and Sharon Stevens. My grandparents owned an archery store. They sold guns, hunting bows, arrows, camouflage clothing, and boots. And I specifically remember my papa. They sold a lot of Rocky boots, and I remember him talking to the distributor and requesting 2 different sizes of shoes just for his specific order for himself. And this was because when he was a child, he had polio, and it affected the way one of his foot grew. So it affected his feet, so he had 2 different sizes of feet. And he also had a smaller calf on the other side. According to the CDC, most people who get infected with poliovirus will not show symptoms. 1 out of 4 with poliovirus will show flu-like symptoms, and a smaller group of people infected with poliovirus will develop more serious symptoms that affect the brain and the spinal cord. So this could be paresthesia, meningitis, and paralysis. When detecting poliovirus, there are several different ways to detect in specimens. This can include a throat swab, a stool sample, occasionally a cerebrospinal fluid. This is isolating the virus in the cell culture, or a PCR test. Transmission occurs when contaminated water is ingested, so it is spread by fecal-oral route. Enters the mouth, infecting the throat, intestinal tract, and then it moves to invade the bloodstream. And I have included a photo that shows the cycle of how it is transmitted. One thing about polio is it can only be spread among humans. So an infected person may spread the virus to others immediately before and up to 2 weeks after symptoms appear. People who don't have symptoms can still pass the virus to others and make them sick. But the virus can live in an infected person's feces for many weeks. I have included some photos of what polio looks like and what it can do. It can definitely affect your muscles and cause deformities, and even worse if it gets into the spinal cord. This is another depiction of what polio can do when it affects the muscles, and it also gives a good image of how it can affect the calves. Like I said earlier, my grandpa, he had 2 different sizes of calves as well as 2 different sizes of feet. So it can affect your muscles, and it can definitely cause deformity. So this is a pretty decent image of what it can do. So how long has polio been around? Poliovirus has been around for a long time. This picture over here is something from Egypt. So medical historians interpreted an Egyptian wall relief dating to around 1580 BCE depicting a man with a paralyzed leg. The first documented description of poliomyelitis appeared in the 2nd edition of Underwood's A Treatise of Disease of Children in 1789. So in 1840, German orthopedist Jacob von Hein documented the first investigation of poliomyelitis. Prior to the 19th century and early 20th century outbreaks, polio was relatively a rare disease. The outbreaks that occurred in the 1800s and the 1900s became epidemics. So polio made its first appearance in the United States in the summer of 1984, and the first outbreak appeared in Vermont. So what can happen to the 1% that we mentioned earlier? They can suffer paralysis. For the small group of people who had the severe effects of polio, to manage this involved a device called iron lungs to survive. This contraption gave mechanical aid to those who needed to breathe and those who could not breathe on their own efficiently. There's also something called post-polio syndrome. Some people who appear to fully recover from polio can later develop new muscle pain, weakness, and paralysis as adults. This is called PPS, or post-polio syndrome. This is a condition that can develop decades after a person recovers from the initial infection, and this can include weakness or muscle weakness, joint pain, and physical and mental fatigue. The gentleman shown below is Dr. Ivar Wickman. So in 1905, he was aware this disease was contagious, but the exact mechanism was not known yet. He knew that this disease was infectious and spread from one person to another. Some people who are infected only show flu-like symptoms and are not near as severe as a small portion of people. Landsteiner and Popper were doctors who discovered that a virus was the infectious agent in 1908, causing polio. Unfortunately, until the 1930s, when the electron microscope was developed in the US, the virus was too small to be seen. Treating polio means treating the symptoms. This requires rest, drinking plenty of fluids, and pain medications to treat the pain. And in severe cases, using the iron lung to assist in breathing. In 1948, a team of scientists at Harvard University isolated and cultivated the virus. And in 1953, Jonas Salk developed the first vaccine using inactivated polio virus. Fast forward a little bit into the 1960s, and Albert Sabin developed a live attenuated vaccine. Because it was orally administered, Sabin's vaccine effectively treated the oral fecal route of infection. Widespread vaccination achieved the end goal of all vaccination, which is herd immunity. In the 1970s, routine immunization became common practice worldwide to treat poliovirus. When it comes to polio, there is no cure. The only thing that can be done for polio is to prevent it with vaccinations. Vaccinating against polio is the only way to prevent the spread, and it's the only way to help eradicate this disease. Vaccinating against polio, there are a few different options. IPV is more of a common practice now. It is an inactivation polio vaccine given in the arm or the leg. There is also an oral polio vaccine, or OPV, and this is given by mouth. Children receiving the vaccine, this is given to them to prepare their bodies to fight the infection. According to the World Health Organization, the United States has been polio-free since 1979. Travelers have brought it into the country, but the last event was in 1992. Poliovirus 2 was completely eradicated in 1999. There has been no record of poliovirus 3 since 2012. So let's fast forward to 2020 and poliovirus 1. There are only 2 countries where polio is present, and this is in Pakistan and Afghanistan. Okay, I hope everybody enjoyed my presentation, and I hope everybody learned something today. Thank you for watching.